A study by the University of Johannesburg looking into how children and caregivers are coping during the COVID-19 pandemic found that 4 out of 10 caregivers did not have enough money to buy the things that they needed, such as food and basic necessities. Now, let's discuss this. We joined via Zoom by Professor Leila Patel from the Social Development Studies at the University of Johannesburg. Prof, thank you so much for your time this afternoon. Now, perhaps give us an overview of the study, including when it was conducted and how many people participated in the study.
So this is a relatively small but more in-depth study, Unati, and thank you for the opportunity. But we're also complementing it with the national data and other research that I am involved with. But the purpose of this piece of work was to gain an in-depth understanding of what is happening to the children in grade R and grade 1, 160 children. We assessed them in terms of their learning outcomes and their schooling and participation, their health, their learning, education. Psychologists assessed those with learning difficulties to assess how many children had learning difficulties. Mental health we assessed, as well as the children's psychosocial well-being. So it is a very comprehensive and a holistic approach to understanding all aspects of children's well-being.
Talk to us a little.
I'm happy.
No, continue,
yes,
Prof.
Please. No, you go ahead and I'll come back in.
I was going to say, talk to us about just some of the findings, especially those that were of concern to you, particularly as they speak to children's nutrition, health, and also just improving their overall emotional well-being.
Mm-hmm. So maybe I should start with what is positive, because we tend to focus always on the difficulties and the challenges. Absolutely. And those are huge, and I don't wish to minimize that. But what we did find is that 80% of the children were attending school, even though it was on a rotational basis. Now, we know that 70 children lost 70% of learning and classroom time was lost last year, so that has had a huge impact on their learning and progression. The teachers and the parents that we interviewed the children, as well as the health professionals who assess the children. The big overriding challenge is the economic impact of COVID-19 on the families and the high rates of child hunger that we see. And this is, of course, is connected also with very high rates of mental health challenges and depression of the caregivers. And 13% of the children presented with significant anxiety identified by the teachers. Now, just because a lot has been said about mental health, and there are national studies of adults, but we also see in our study it's 55% across the 5 areas. The caregivers tested positively for symptoms of depression. And this went up to 70% in some of the areas. In Soweto and in Doornkop, for example, also in Soweto. 68% of the caregivers were really concerned about safety of the children, and this is their health safety, also from protection of infection and the virus, but also concerns about exposure to violence in the home and the community. So these are some of the major challenges that we identified. I'm happy to speak about others, but what we did see, and when I make the point about the economic impact, is unemployment. And 65% of the caregivers reported high unemployment and very high rates of indebtedness. So the material well-being of the children were hugely impacted. They did have access to basic services, even though that was perhaps of poor quality, but that was certainly also very positive.
Now, Prof, you mentioned some of the positives, and because we are still in, in this pandemic, especially because we are in the third wave, which is worse than the first and the second waves, talk to me about just some of the positives, the positive outcomes. Did the parents, perhaps, those that were able to overlook their socio-economic challenges, give an understanding of how they were able to cope and how they were able to deal with their children, especially from a psychological perspective during this time?
I think that this is a huge gap and a knowledge gap that we have, because we don't often focus very much on the strengths and the agency that people have and how they cope. But the children on the whole were doing well. Obviously, there were those who were really struggling, and the numbers I've shared with you, and that is very alarming. But what we do see is that parents were involved as far as they could in doing homework with children, although the teachers felt that this was inadequate. So in exploring this more with the parents, many felt that they would have benefited from having learning material to help them to work with children at home. So I think that was very positive to learn about as well. We have used this data, if I may say, to work with the parents and the teachers. And in each of the schools, we have a social worker and we have teachers and health workers. And we formed what is called a community of practice. And together we are all problem solving with the teachers, the parents, and the other professionals to help find solutions. And between us, we've all agreed on what we thought the highlights should be. Now, there are some children who have incomplete vaccinations. So we're looking at how to get them vaccinated. This is just their normal vaccinations. Food security, how can we support those households that are struggling with food, having not sufficient food? And almost 25% of the children, caregivers said that the children were sometimes hungry. So that is crucial to address hunger, because that can lead to further health challenges, and that in turn also impacts on children's school performance. So I think what we've seen in COVID is the emphasis and understanding of the impact of poverty on children. And I think the Department of Education, in a webinar that we had yesterday on this research, felt very strongly that this was something positive that has come out of the pandemic, and that in future there should be more interventions that are integrated and holistic, so that we don't have systems failure, and that there's better collaboration, coordination, and working together to solve these challenges.
Professor Patel, thank you so much for your time and the work that you are currently doing. Professor Leila Patel from the Social Development Studies at the University of Johannesburg. Thank you so much.